Will's our third son, and at 2 months of age, we had found out that not only did Will have cancer, but a very rare form of cancer, and we started chemotherapy treatments right away.
To know that there's people on your side from day one is so critical, and I think that's the message to get across to people is, wouldn't you, if you were in that situation, wouldn't you want someone standing by your side?
Journeys is a special program to help support the sickest children here at the Children's Hospital. Sometimes in crisis, sometimes with a very unexpected, serious medical problem. And it throws the families into turmoil and worry and chaos sometimes. And we're here to help support them.
Palliative care can begin at the time of diagnosis. And in my specialty, sometimes that diagnosis comes even before birth. The Journeys program really wants to walk with them as a form of continuity, be there and adapt with them as this journey unfolds. For some patients, this journey could last years or more, and their needs might change over that period of time. And this program really embraces that.
And also to prepare us. You're never really prepared, but to explain, though, these are some things that might happen. What plans do you have? They still let me feel like a mom.
We hired a chaplain full-time. I have a social worker, I have a nurse manager, and myself, and there's other physicians who participate. We're able to address not only the medical issues, but some of the spiritual and emotional issues that children struggle with as they go through a serious illness.
They were our family. They are our family, and they were Will's family. So having them here to walk us through and explain, these are some things that are going to be happening now, some things you're going to see. It gave us comfort, and it gave us the strength to really get through those days.
When you have a child who is struggling with an illness, all these other factors in your life become a struggle, whether it's work, whether it's paying bills, whether it's remembering to get food on the table for your other children. Our program really understands that, and we're compassionate to that, and that's why we work so closely with outside foundations who understand what we do.
I think we talk about the Journeys program and then what we do as a foundation. It's about building a legacy for your child, and what greater legacy is to walk down the hallway and see his name right near a room.
This space, the Brave Will Room, is a space for a family to come and be together, be able to do everything as a normal family would, with the safety of the doctors and nurses right outside the doors, so that when they've reached the end of one part of their journey, while they're in this space, they can still make memories. For us, it was really important to know that we could spend all that time as a family, and behind the scenes, the doctors and nurses were taking care of everything that needed to be taken care of.
When we see things like the molds and we see the handprints on the paper, that's life for us.
Palliative care isn't about giving up in the end. Palliative care is about trying to walk that journey with that family and that patient to try and optimize everything we possibly can for that child.